Welcome to the medical terminology video focusing on the musculoskeletal system, presented by Synergy Medical Coding Academy. The musculoskeletal system encompasses the bones, muscles, and joints. The field of medicine dedicated to this system is called orthopedics, and a specialist is an orthopedician or orthopedist. Our approach to studying the musculoskeletal system involves looking at the organs, diseases, causes, symptoms, and the different forms of treatment, including medical and surgical options. Key structures of the musculoskeletal system include muscles and fascia, tendons, bones, cartilage, ligaments, joints, and bursa. These components work together for support and movement. The skeletal system provides the body's structural framework, protection for internal organs, and assists movement. It consists of 206 bones, making up about 20% of adult body weight. The study of bones is osteology, and the treatment of skeletal disorders is orthopedics. The skeletal system's functions include providing a structural framework, producing body movements, serving as a center for hematopoiesis in the bone marrow, maintaining mineral homeostasis by storing calcium and phosphorus, and providing triglyceride storage in the yellow bone marrow. The skeletal system has two main divisions: the axial skeleton, which supports the head, neck, back, and chest, including the skull, vertebral column, and thoracic cage, and the appendicular skeleton, which includes the limbs and girdles. Bones are classified into four main types: long bones, like the femur and humerus, which have a long shaft. Short bones, like carpals and tarsals, are cube-shaped. Flat bones are flattened and curved, like the skull and ribs. Irregular bones have irregular shapes, such as the vertebrae and facial bones. Cranial bones of the skull include the unpaired frontal bone and paired parietal, temporal, and sphenoid bones. Other cranial bones are the occipital and ethmoid bones. The facial skeleton is composed of 14 bones. These include the paired nasal, lacrimal, inferior nasal concha, zygomatic, palatine, and maxilla bones, and the unpaired vomer and mandible bones. The thoracic bones include the clavicle, sternum, and ribs. There are 12 pairs of ribs. The first 7 pairs are true ribs, ribs 8 to 10 are false ribs, and ribs 11 and 12 are floating ribs. The vertebral column consists of 33 vertebrae, divided into 5 regions: cervical, thoracic, lumbar, sacrum, and coccyx. The shape of the vertebrae differs across the sections, as seen in the examples of the cervical and thoracic vertebrae. The scapula, or shoulder blade, is an important bone for shoulder movement. It articulates with the clavicle and humerus, supported by several ligaments, including the coracoclavicular and coracoacromial ligaments. The arm bones consist of the humerus, the bone of the upper arm, and the radius and ulna, which are the bones of the forearm. The wrist is made up of 8 carpal bones, including the scaphoid, lunate, trapezium, trapezoid, capitate, hamate, triquetrum, and pisiform. The hand also contains 5 metacarpal bones and 14 phalanx or finger bones. The pelvic girdle is a collection of bones supporting the trunk and articulating with the femur to form the hip joint. Key bones include the ilium, ischium, and pubis, forming the pelvic cavity. The lower limb bones are essential for movement and weight-bearing. These include the femur, patella, tibia, and fibula. The human foot contains 26 bones, divided into 3 groups: tarsal bones, metatarsal bones, and phalanges. The tarsal bones include the talus, calcaneus, and 5 tarsals forming the midfoot arch. Metatarsal bones form the midfoot, and the phalanges are the toe bones. A joint is where 2 or more bones meet to allow movement. Joints are classified as either movable or immovable. Examples of joints include the shoulder, elbow, hip, knee, and ankle. The shoulder joint is a flexible ball and socket joint. Ligaments and tendons stabilize it, and 4 short muscles form the rotator cuff, crucial for movement and stability. The hip joint is a ball and socket synovial joint formed by the femur head and pelvic acetabulum. It is a major weight-bearing joint stabilized by extracapsular and intracapsular ligaments. The knee is one of the body's largest and most complex hinge-type synovial joints. It allows for flexion and extension and is formed by the patella, distal femur, and tibia, with tendons and ligaments ensuring stability. The muscular system is responsible for movement, maintaining posture, and producing heat. Muscles are vital components of the musculoskeletal system, working with bones and joints. Cartilage is a type of connective tissue found throughout the body, especially covering joints like the shoulder, elbow, knee, hip, and ankle. It's also found in the ribs, spine, ears, nose, and airways. Other supportive structures include tendons, which attach muscle to bone, and ligaments, which hold bones together at joints. Bursae are fluid-filled sacs that cushion bones and reduce friction during movement. Symptoms and signs of musculoskeletal issues can include pain in any body area, joint pain, joint stiffness, limited range of movement, joint swelling, deformities, abnormal gait, cramps, and spasms. Traumatic fractures are partial or complete breaks in bone continuity due to excessive force. These fractures can be classified as open or closed and displaced or non-displaced. Different types of traumatic fractures include transverse, oblique, and spiral fractures, depending on the line of the break. Further classifications of traumatic fractures include comminuted, segmented, avulsion, impacted, torus, and greenstick fractures. Pathological fractures are breaks in a bone caused by an underlying disease, such as osteoporosis or a tumor, weakening the bone structure. Osteomyelitis is an inflammation of the bone and bone marrow, typically caused by an infecting organism, usually bacteria like Pseudomonas, MRSA, or Enterobacter. Paget's disease is a chronic skeletal condition, causing abnormally rapid bone destruction and reformation. This results in the enlargement and weakening of bones, commonly affecting the skull, pelvis, spine, and long bones. Spinal disorders include kyphosis, an abnormally excessive convex curvature of the spine, scoliosis, an abnormal lateral curvature, and lordosis, an excessive inward curve of the spine. Disc herniation, or a slipped lumbar disc, often causes sudden severe lower back pain. The prolapsed disc may press on a nerve root, leading to radiculitis. Other spinal disorders include osteoarthritis of the spine, also known as spondylosis or degenerative joint disease, and spinal stenosis, which is the narrowing of the spinal canal. Joint diseases, or arthritis, refer to the inflammation of joints. This includes osteoarthritis, rheumatoid arthritis, gouty arthritis, infectious arthritis, and ankylosing spondylitis. Dislocation of joints occurs when the bones forming a joint are forced out of their normal alignment. Examples include dislocations of the shoulder and hip joints. Cartilage disorders, such as chondromalacia, involve the softening or damage of cartilage, often in the knee. Osteochondritis is inflammation of the bone and cartilage. Other cartilage disorders include chondropathy, which is a disease of the cartilage, and meniscal disorders affecting the cartilage in the knee joint. Disorders of the supportive structures include bursitis, the inflammation of a bursa, ligament sprains and strains, and tendinitis, the inflammation of a tendon, such as Achilles tendinitis. Here we look at additional medical terminology, defining terms related to surgical procedures and diagnostic tests for the musculoskeletal system. Further medical terminology related to the musculoskeletal system includes terms describing imaging, such as arthroscopy, and other common medical terms. This slide presents abbreviations commonly used in musculoskeletal medical documentation, such as ACL for anterior cruciate ligament and DJD for degenerative joint disease. More abbreviations include FX for fracture, OA for osteoarthritis, and THR for total hip replacement, important for efficient medical communication. This concludes our video on medical terminology for the musculoskeletal system. Thank you for watching.